Nelson Medical Practice is open 24 hours, easily accessible to the patients. So if they got any problem, they are more than welcome to be seen by a GP. There is always a resident GP here. Sometimes there are 2 or 3 clinicians working at a time to see the patients. And at out of hours, we do carry out home visits if the patient is housebound and elderly, and we do see patients at the base, and we do give telephone advice as well. So I think that's a big advantage that they have got such a nice building, and now it is used 24 hours.
Take a seat, Sandra, make yourself comfortable. How are you? The concept really frees doctors' time for more complex perhaps cases. It is solely for minor illnesses, and it also gives patients more choice and more opportunity to have that option, because there's more appointments free. So it's worth coming back, wasn't it, just to put your mind at rest?
You know, you get a lot of services for the patient and at one sort of roof, so they don't have to travel a lot if need be. So now what we are doing is, we are planning this to become a training practice. So in that way, that will also meet the demands of our GP school, and will help our own GPs to advance.
It's a very positive move for the practice, because we can integrate better with the community services. We have an excellent clinical team here with 4 GPs and 3 practice nurses and the administration team, all having their very own individual skills that support our patients.
My career path initially was in secondary care, and I worked mainly, after a very brief spell as a surgical nurse, I worked mainly for the emergency division of the local trust, which I loved. I loved that background. And by sheer chance in a conversation one day, somebody said, "Oh, Theresa, I think you'd like practice nursing." And I went to practice nursing on a part-time basis, and was fortunate enough to be supported that I could still work on a part-time basis also at the hospital. There is quite a lot of sort of health education, health promotion in primary care. There's routine things such as travel health, immunisation, etc., and women's health and screening programmes. And chronic disease management is a very important role of the primary care nurse. And also, of course, unexpected things do come through the door, and I think my experience in the acute sector has helped me it helped me along with this, and also helped me develop the new role of minor illnesses. Well, I think as a nurse there's potential always for development. I intend to keep updated. I intend to sort of develop possibly a little bit more of a teaching role, and the practice does aim in the future to have medical students, and I would love to be involved in that. I've absolutely loved the challenge. I loved going back to university, and I never felt, albeit a more responsible role, I've never felt on my own in this. I have been well supported by all members of the team.